Hello everyone, now let us see how to search a CPT code. In the current session, we will be discussing a question from Evaluation and Management. Coming to the question, today Glynn was discharged from a nursing facility after recovering a hip replacement. Nursing facility. Remember the term nursing facility. It took Dr. Loma 45 minutes to complete the final detailed examination, review detailed history, surgery notes and lab work, write refills for prescriptions, complete orders for continued physical therapy and provide detailed verbal instructions to Glynn and his family regarding his ongoing care. How would Dr. Loma report her services? So these are nursing facility services. The options are 99024, 99239, 99309 and 99316 and option D is 99316. We know that the nursing facility services are divided into initial nursing facility, subsequent nursing facility and nursing facility discharge services. In our question, we are focusing on discharge services. But let us briefly discuss about the initial and subsequent nursing facility services also. Coming to the CPTs for initial nursing facility services, they are 99304, 99305 and 99306. These are for initial nursing facility services. There is no distinction between new and established patient for initial nursing facility care services. Whether it is a new patient or an established patient, these are the codes for initial nursing facility care. And in order to code 99304, all the codes required medically appropriate history and examination, and MDM or time are taken as determining factors. Whenever MDM is considered as a determining factor, in order to code 99304, you need to have straightforward or low MDM. And whenever time is considered, it must meet or exceed 25 minutes time. And in order to code 99305, you need moderate MDM, and whenever time is considered, 35 minutes must be met or exceeded on the date of encounter. And in order to code 99306, you need high level of MDM, and whenever time is considered, 45 minutes must be met or exceeded. And for services longer than 60 minutes, for services 60 minutes or longer, use the prolonged service code, add-on code plus 99418 along with 99306. Coming to subsequent nursing facility care services. The subsequent CPTs are 99307, 308, 309 and 310. All require medically appropriate history and examination. In order to code 99307, subsequent nursing facility care, whenever MDM is considered, they require straightforward MDM. And whenever time is considered, 60 minutes must be met or exceeded. And in order to code 99308, it requires low level of MDM. And whenever time is considered, 15 minutes must be met or exceeded. And in order to code 99309, moderate level of MDM is required, and whenever time is considered, 30 minutes must be met or exceeded on the date of encounter. And in order to code 99310, high level of MDM is required, and whenever time is considered, 45 minutes must be met or exceeded. And for services of 60 minutes or longer, use prolonged service code plus 99418 along with 99310. These are the subsequent nursing facility care CPTs and their requirements. And there is no distinction between new and established patient, even in this case also. And now coming to nursing facility discharge services. The nursing facility discharge management codes are to be used to report the total duration of time. Here time is considered. The nursing facility discharge management codes are to be used to report the total duration of time spent by a physician or other qualified healthcare professional for the final nursing facility discharge of the patient. The codes include, as appropriate, final examination of the patient, discussion of the nursing facility staff, even if the time spent on the date is not continuous. The time need not be continuous. Instructions are given for continuing care to all relevant caregivers and preparation of discharge records, prescriptions and referral forms. These services require a face-to-face encounter with the patient or family or caregiver that may be performed on a date prior to the date the patient leaves the facility. And the code selection is based on the total time. Remember this, for nursing facility discharge services, the code selection is based on the total time on the date of discharge management face-to-face encounter. And there are two CPTs for nursing facility discharge services, 99315 and 99316. If it is 30 minutes or less, the time spent on the date of encounter, 30 minutes or less, you need to code 99315. Whenever it is more than 30 minutes, you need to code 99316. And in our case, it is 45 minutes. So, the appropriate code is 99316. Now let us see the question once again. Today, Glynn was discharged from a nursing facility after recovering from a hip replacement. It took Dr. Loma 45 minutes to complete the final detailed examination, review the detailed history, surgery notes and lab works, write refills for prescription, complete orders for continued physical therapy, and provide detailed verbal instructions to Glynn and his family regarding his ongoing care. How would Dr. Loma report her services? So the correct option is option D, 99316, because the total time is more than 30 minutes. It is 45 minutes. The correct option is 99316. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.